Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We're committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Jonathan Shepard. He is a board certified psychiatrist and the chief clinical officer at the Department of Behavioral Health in Washington, D.C. He oversees mental health and substance use disorders. Dr. Shepard is on a mission to improve the well being and outcomes of people with behavioral health challenges by providing evidence based, culturally responsive, and trauma informed care. He's also the president of the board of directors of the Black Mental Health Alliance. Dr. Shepard, welcome to the show today.
Thank you. Thank you. Thank you, Mr. Possibility. That's wonderful.
I appreciate that. And look, I've been looking forward to talking to you for a long time. But first, this reminder to our listeners and our viewers, follow, like, and share this podcast. Wherever you find it, your support matters, and it helps us attract guests like Dr. Shepard. Hey, Doc, I think a lot of people are wondering about psychiatry. So what is psychiatry?
Psychiatry is a branch of medicine in which a person studies the brain and behavior of a human being. It is a wonderful field and study of medicine. Some people don't realize that you must become a physician, a medical doctor, in order to become a psychiatrist. I think because the word psych is the prefix to so many of the type of mental health professional titles that you can hold, that people get it confused. Psychiatrist is different from a psychologist. So the study of psychiatry, you must go through medical school so you can understand how the mental health of a person relates to the physical health.
Uh-huh. So look, you're in medical school, you're first year medical student, second year medical student, you're thinking about specializing. What drew you to psychiatry?
Yeah, I love the brain. So I am an anatomy person. So I love anatomy. Used to love to go and study and dissect the human body. And I love the brain and studying the brain. And I began to fuse that love with the behavior part of it. So in my first year of medical school, studying brain and behavior, that particular class I did exceedingly well in. I then had an opportunity to do an internship after my first year of medical school, working with a child as a psychiatrist. Now, I had not thought I was going to be a child as a psychiatrist. I must be honest with you, Mr. Possibility, that I took the internship because it was a free trip to Hawaii. That was that's the reason why I did the internship. I'll just be straight up with you. But in doing so, working with the child as a psychiatrist that was assigned to me, I began to see myself operating in that field. So what I thought was just a whim of a chance, it actually was a path that was designed for where I would ultimately end up practicing.
Wow. Do you recall the moment you made the decision, I'm going to practice psychiatry?
I do. It was a very difficult decision.
Mm.
It did not feel good. My friends talked about me because it was in my fourth year. I actually had applied to two different specialties. So once you're ready to come out of medical school, you must go through the match and you must apply to get into the match. And so I applied to two different specialties, psychiatry and neurology, because I felt that, why psychiatry, as my friends were teasing me. And I will never forget, it was on a Sunday. I was driving to church and I was listening to a preacher on my way to church. And it was like God was speaking to me through the preacher. And it was resolved in my heart that I was going to study psychiatry and become a psychiatrist. I have not looked back since then. And those same people who were talking about me, they wish they could come over and be as successful as I have. So no
That's a great
regret.
story, especially when you said that it was in your heart, it was resolved in your heart. That's a wonderful story. So, what is one difference between a psychiatrist and a psychologist?
The major difference is medical school.
Uh,
Huge difference. And so a psychologist does not go through the rigors of medical school. I respect the field of psychology. So for those who are listening, please know that I respect you in your rightful place. But a psychologist is not a psychiatrist. And I will
Right.
emphasize that all day. You did not go through the rigors of being on call as a medical student. You did not go through the rigors of being a resident and having to literally run units and not be paid for it through an apprenticeship. We call that residency, but it really is an apprenticeship. So there is a huge uh, gulf in knowledge between a
Wow.
psychologist and a psychiatrist. Psychiatrist is able to treat the human body. I'm able to prescribe any type of medication that is needed.
Mm,
So
mm.
the level of understanding of the physical body is different. So it is a gulf between the two.
Yeah. Okay. Hey, look, writers like Wayne Dyer, the late Wayne Dyer back in the day, and some popular writers today, I'm not going to call their names specifically, but many of them say, you change your story, you change your life. Speakers go around the country saying, change your story, change your life. As a psychiatrist, what do you think about that? That you change your story, that you can actually change your life?
No, that is a very interesting question because people want to change their stories into something that is more acceptable,
Mhm.
that's not as less traumatic. I tell people embrace your story as opposed
Mm,
to change your story.
yeah.
Because when you talk about changing your story, you're literally trying to change the impactful events that occurred to you for a reason. Now, these
Mm,
reasons that occurred to you, you may not have liked them, and some of them may not have or were not supposed to happen to you, but
mhm.
unfortunately, they did, and we cannot change them. So we have to be very careful when we tell people to change their story because people will literally live in a fantasy land. So
Yeah.
we have to be careful that we don't push people over into a story or a land that didn't really exist. So I tell people, embrace your story. Because when I look at my story, yes, thankfully, I've been able to come through many hard trials,
Mm,
different things and challenges I had to overcome.
mm.
But I have to embrace my story. My story was not all roses and
Yeah.
peaches and cream or whatever the analogy may be. I
Yeah.
have to
Yeah.
embrace my story. So I tell people when you're looking to make that narrative change, and I
Mhm.
get what they're saying, embrace it and know that when
Yeah.
you embrace it, you can then work so that that story can now be cultivated to work to your advantage.
I love it. The two things that occur to me based on what you've said, and firstly, you mentioned you've gone through adversity, you've experienced. People forget that a doctor like yourself is still a human being,
That's
and I'm
right.
so glad that you were transparent enough to say that you have had challenges in your life. So my question to you, doctor, is that do your have your challenges in your journey of life made you a better psychiatrist and practitioner of your trade?
The answer is yes, 100%.
Mm,
Most recently, the COVID-19 pandemic that we went through literally shifted my practice and shifted the way in which I approach people.
mm,
Because it was during that pandemic that I actually experienced a resurgence, a rejuvenation, if you would. While many people were breaking down, I actually
mm.
was being built up during the pandemic, quite
Wow.
contrary to many of my other colleagues, because it was allowed for me a chance to finally pause and get to know who I am. And as I
Mm,
began to know who I am, it made me more sensitive to the other issues that I deal with so that I can now be a better person for the people who I'm treating. I will never forget the people who have been with me for years. They came to see me after the pandemic or even throughout the pandemic because of the various issues that were still occurring within their lives. And they would say, something's different about you. Something is shifted, something
mm,
has changed. And they were
mm.
right. I didn't go into all that as to tell
Yeah.
them what it is, but they could tell that there was a difference in my approach. There was a
Mm,
difference in my ability to let them talk. Because one of the things I realized during the pandemic is that you cannot rush people through this process. I told the
mm,
people that I worked with that I need more time with the patients. You have to allow the people to be able to even get out what they've gone through since the last time they've seen you before you can even move forward with the treatment plan. And that requires time, especially when you're on a virtual platform. People, they would log in, not know how to log in. They forget how to log in. Take them 15 minutes and 30-minute session. Half your time is trying to figure out how to get into the session. And so I had to allow people time. And so that ability to allow people to take their time to be able to talk about what they're going through really allowed for my practice to shift, to change, and be able to see those results that were needed.
That's fantastic. And what I hear from you, and let me ask you the question, did your capacity to empathize with your patients go up because of your experiences and your journey during the pandemic and before?
Yes, absolutely. I remember clearly. I made a boundary before a stance, if you would, before the pandemic. I was not seeing patients on Saturdays and Sundays. Period.
Okay.
I don't care how bad it was. I am not seeing you. And I had to change. I couldn't tell the parent who now is working at a job in the Department of Justice. They couldn't get anybody to cover the shifts because people were sick. People were dying from COVID-19. And the mother had to be there 72 hours straight. And the only time she could see me was on a Sunday. I couldn't be like, well, that's, oh, well, you're out of luck. No, I had to be able to empathize with what was happening within their family, within their community, so I could be able to take care of that particular child at that time. So that's just an example of where we as the physicians, we as those who are caring for people, had to make some maneuvering and change even our own stances about stuff. Now, I'll be honest with you, Mr. Possibility. I'm not seeing patients every Sunday now. I haven't gone off the deep end.
I
But
got
I
you.
am willing to make those adjustments when necessary.
That's so reassuring to talk with a medical doctor, a scientist, a well-trained practitioner who has a heart. That's a good thing. You said something else, Dr. Shepard, that piqued my interest. You mentioned, I'd ask you a question about what people have written about, like Wayne Dyer, change your story, change your life. And you said, you understand what they're saying, but, sometimes it's good to embrace your story. And that reminded me of acceptance, of radical. I'm even using the term now, radical self-acceptance. So let me ask you, is there power for a person in really coming to accept themselves, the good and the bad, who they are?
Absolutely. We have to embrace our story. We have to embrace the way in which we've been made, embrace the history. And I tell you, I work with a lot of Black people, and many times as Black people, we've been told that we need to shift, we need to change, we need to adjust who we are in order to be able to conform. And I let people know, and I'm a strong advocate, you do not conform to someone else's standards just because of your race or your color. Absolutely not. You stand up, and when people tell me to adjust, I do adjust. I adjust, and I become more of me. That's what it is. And so,
I love it. I love it. Yeah. Yeah.
Absolutely. I want people to know
Yeah.
that you must accept who you are. That really is a challenge for people. Because let me tell you, when I work with Black male physicians, identity crises is one of the major issues that they struggle with. It's not intellect. It's not knowing what to diagnose the people with. It's not knowing how to be able to even treat. It's about who they are and who they allow people to treat them and how they are being viewed. And I remind them that yes, you are a Black physician. Yes, you are a scientist, but you also are a person, and you must stand up for your rights. And you let these people know that you just can't come in, whether they be your supervisors or even the patients, believe it or not, because patients are coming and trying to tell you who you are. And remind them, no, I know who I am. I've been through this longer than many of you all have ever even experienced. And so that sense of identity is missing. So please accept it. who you are.
Yeah, indeed. I love it, Dr. Shepard. You mentioned that I know that you are a child psychologist as well as adolescent and adults. But I want to ask you about children. What kinds of things in your practice clinically do children present today?
Yeah, so for children, the most common mental health disorder is anxiety, period.
Mm, yeah,
So most children who are coming in for children and adolescents, and really adults, since the pandemic, we have seen a surge in anxiety.
yeah.
But the most common mental health disorder is anxiety. So children will come in with the inability to focus, concentrate,
Mhm,
can't sit
mhm.
still. And these sound like symptoms of ADHD. And so
Yeah.
parents will come in and say, oh my God, my child has ADHD. The teachers are saying that they can't learn, they can't sit still. And
Yeah.
so I don't jump to that conclusion that they have ADHD because some of them may, but many of them have anxiety issues. And let me
Mm,
tell you, most people would rather have ADHD than anxiety issues. And I don't know why that is. I don't know.
mm,
I'm not sure if there's a stigma behind that, because people will believe that anxiety is not a disorder. But anything that causes you to be able to be dysfunctional and not be able to operate at your optimal level, that is called a
yeah.
disorder. And anxiety
Mm,
definitely can cause you to not be able to function for that child at school, at home, be able to perform the way in which he or she needs to do. And so anxiety is the major thing that we'll see. We see depression, we see ADHD. Those are probably the
mm,
top three that we
uh-huh.
will see in that age group. And that's between ages 1 through 12.
Yeah, it must be confusing to a child, I would say, even to adults who feel a certain kind of way and don't even know why. It must be a little confusing. Is that right?
Absolutely.
Mm,
I'm working now with a family that has anxiety, and many children who have anxiety, their parents have anxiety, and it's just filtered on down. Almost 95% of the children who have anxiety, their parents have anxiety. And it is confusing because they are watching their parents try to manage their anxiety, and they're like,
yeah,
well, what am I supposed to do? If my parent is anxious, and I know that I shouldn't be anxious, and you're trying to tell me not to be anxious, but when I get home, they're spazzing out.
yeah.
So they are confused. They're
Mhm,
also confused because of the different things that they hear from their peers, from
mm,
the various things they hear from society. We have to be so careful what our children are taking in. We're on information overload. If they
yeah,
have a smartphone, they can hear about all the various things that are happening throughout the world, the
yeah,
bombings, the people who are now unable to get food, able to get shelter, clothes. That is scary. And at
yeah,
their age, they wonder, is that going to happen to them? Could that happen to their families? The tornadoes that happen throughout the United States of America, the horrible storms, all of that happens, and these children are reading this, and if they're not understanding it, they're not being able to digest that with a person who can
mm.
give them clarity. It causes this anxiety that we see right now.
Yeah. You mentioned that sometimes not only the child has it, anxiety symptoms, but the parent also. Is there a genetic component? Is it environmental? That is the household that they're in. What is this thing? Where is it coming from?
Yeah, so in psychiatry, we have the different components. We do have environmental factors that play
Uh,
into a person's mental well-being. That makes sense. But there is a strong genetic component also
mm,
that we see in various disorders. And anxiety is one of those that we see a nice mixture, if you would,
okay.
between genetic factors and environmental factors, social economic factors.
Yeah.
Because remember, all these different things play into a person's mental health. If you remember
Yeah.
what the word mental health is, it has four components to it. It's potential, ability to cope, work, and make a contribution. Mental health is
Mm,
not the same as mental illness. We must be clear about that. And so
uh-huh.
when you look at the various factors that I just described, they will affect the person's ability to know who he or she is, that's potential,
Mm,
and know the untapped skills and possibilities. They will then
yeah.
affect the ability to cope, which means be able to get over whatever they're getting through with success, be able to work. That means be able to do it effectively and effortlessly, effortlessly. There we go.
Yeah.
That word is a little hard there. And then be able to work and make a contribution. Because when you make a contribution,
Mm,
that helps us understand what things you're able to contribute to our society. That's
yeah.
what mental health is.
Yeah, I love it. That's right. I'm glad you said that. Now, I want to stay with this anxiety thing for a moment. So, let's say that someone recognizes that they are anxious to a point where it's affecting their daily life. Is it possible for a person to get out of that? And what kinds of things do you use to help them, see past it, grow past it, however you want to say?
Yes, I am. That's one of the reasons why I went into psychiatry as opposed to
Mm,
neurology, because we see benefits of persons getting better, the benefit of the person getting better. In neurology, people do get better. Unfortunately, in neurology, you tend to see persons who have a stroke or some other neurological disease, and you're kind of doing maintenance. In
mhm.
psychiatry, you actually see people being cured, being able
Yeah.
to get better. So with anxiety, it's a two-pronged approach. Psychotherapy, which
Mhm.
really means talk therapy and the different modalities of that, ways to be able to help the person to calm down so that they're able to do whatever function that they're being asked to do or complete a task that they're able to do. And then
Mhm.
the other approach is with medication. And we don't approach both of those modalities the same way. Medication is approached when the person is no longer able to function at a level that he or she should be able to, and it's
Mhm.
impacting them so much that it is now really hurting them and affecting them negatively. And
Mhm.
so that's when we need to have a conversation about medication. Why is that important, Mr. Possibility? Because
Mhm.
anxiety is real and it is normal. I want to say that again. Anxiety is real and anxiety is normal. Everybody has it. Anybody who says they don't have anxiety is lying to you. All right. They're
Okay.
lying to you. And I say it right here and I say it again. Everybody has anxiety because it's part of who we are as a human being. But everybody's anxiety doesn't take them to the place where they can't function and they're paralyzed. And so that's when the disorder comes into place. And that's when we know that medication needs to be considered. So all of us could benefit from therapy and how to be able to manage our anxieties. Even as I prepare for this show, even as you're listening to me, I might look confident, but there may be
Mhm.
some butterflies inside of me being
Mhm.
anxious, and that's just normal. But it allows for me, I don't allow those butterflies, I don't allow that anxiety to take me out to where I pass out while I'm doing this show. I allow it to
Right.
be able to help drive me and drive that point home so that I come across looking like, man, he knows what he's talking about. But okay, that's wonderful. But I stay
Yeah.
humble because I know inside it don't always feel that way.
Well, I'll tell you what I want to say here now, because I've read enough to know that any professional like yourself who is transparent enough to say what you've just said is an amazing. I mean, my confidence in you just went sky high because you're able to say that. But what kinds of things that should parents look for? People who, you're raising kids, you got to be aware of what's going on. What kinds of things should they look for to try to make sure that they raise healthy children? And I want to focus just on anxiety now.
Yeah. So you look for any change of behavior for the children. You look to see are they eating correctly or appropriately. There may be a change in their sleep pattern. They may not want to sleep as long, or they sleep too long. They might be
Mhm.
scared to sleep in their own bed. I've even seen where adolescents they revert back to the childhood years because they're
Mhm.
fearful of something that may have happened. They complain of nightmares. They complain about various other things that literally did not used to scare them before.
Mhm.
I've seen where children have been traumatized and are anxious to be around certain people. Social anxiety is real. And so, not wanting to go outside to interact with other people, not want to interact with
Mhm.
family members. Um, and even with anxiety, you'll see a heightened sense or a sensation, if you would, of
Mhm.
sounds. They may hear a certain sound or even a smell, and it takes them and literally cause them to spaz out, to really have an increased
Right.
fear response. So those are some of the things that you would look for
Mhm.
children who are anxious. Um, yeah, and many times they'll tell you. If you
Mhm.
listen to the child, they'll tell you what's going on.
Yeah. So what about this approach of a parents to a child or even adult to another adult? Snap out of it. Good advice, doc, or bad advice?
I would never tell somebody just to snap out of it. I would ask it a different way. I would say, what's going on? How are
Mhm.
you feeling? Um, what's making you feel like this right now?
Mhm.
So ask some questions like that as opposed to giving a directive a snap out of it.
Right.
Because I don't know what the it is.
Yeah, yeah, I got you. And and I'm thinking about children and growing up, a kid growing up and afraid of the dark. And back in the day, Doc, what they would say to us is, "Be a man." What do you think about that advice? It's a kid is afraid of the dark.
Yeah, and I understand that, and we have to think about people's homes.
Mhm.
And so many of us have grown up in different environments now.
Mhm.
So I understand that. We have to be careful of how we label people as being less than.
Mhm.
What do I mean by that? So you're talking to a 12-year-old boy. Well, man up.
Yeah.
You shouldn't let that scare you. Well, we don't know what happened to his story, as I talked about, embracing the story. We don't
Mhm.
know that someone was sneaking into his room when he was 5 and 6 years old in the middle of the night, trying to touch him or trying to do something to
Mhm.
him. We don't know. It might be in the middle of the night where his family had to escape a fire. We may not
Mhm.
know what happened in the middle of the night when they did not have a place to sleep and they got kicked out of their apartment or home. We just don't know why.
Yeah.
Uh, and let me tell you, and again, I know that's kind of extreme.
Mhm.
He might be watching a scary movie.
Yeah.
Let's keep it
Yeah.
real. You know, he might be watching some movie he probably should not have been watching. And
Right.
now they are, so scared and they hear a little sound and they think that this movie, because movies seem so real now,
Mhm.
it literally freaks them out.
Right. One more thing about anxiety, Dr. Shepard. I'm assuming, and that's why you're the specialist here. If a person catches it early, is the prognosis for resolving it better, or than if they let it, continue to grow until it's like a bucket of water that's spilling over?
Yeah. So when we talk about prognosis and mental health, overall, when you're dealing with anxiety and mood disorders, if the
Mm-hmm.
person's consistent in treatment, prognosis tends to be good.
Mm-hmm.
There are some of the mental health disorders where prognosis tend to be less, and that tends to happen with how long a person has dealt with the mental illness or mental disease, because it
Mm-hmm.
is a disease. Um, but yes, the earlier that a person gets into treatment, we tend to have better outcomes. It's not a guarantee, but we tend to have better outcomes. One of the major things that happens with or associated with better outcomes is consistency.
Mm-hmm.
What do I mean by that? That means that parents, the children, adolescents, or whoever the patient is, must be consistent with the treatment process, and so that really is the determining factor.
Right. I want to, and I know these things all run together, but I want to make sure that we talk about depression, by itself for just a moment. So, what is this thing called depression? What is depression? What does that mean?
Mhm. Depression is a mood disorder,
Mm-hmm.
and depression is a real illness. People use the word depressed loosely, and I really believe if they really knew what depression was or the disease is, they would not use that word depressed. It can be it's a constellation of events or symptoms. And I use the word events because the symptoms occur within events, if you would. SIGECAPS, it is an acronym, SIGECAPS, 8 symptoms that we can experience or a person can experience for 2 straight weeks. So it's interesting that people will say they're depressed, but then when you look at the time frame, I'm like, wait a minute, you have that you've only been feeling like this for 2 hours, as
Yeah.
opposed to 2 consecutive weeks. And so, what are those symptoms? I'll go through them very quickly. There's a change in your sleep pattern, change in your level of interest in doing things. There is guilt, excessive guilt, change in your level of energy, change in level of concentration, appetite. The P is a big word, psychomotor retardation or agitation, basically meaning that there's an increase in your ability to, a decrease in your ability to self-regulate. That's really the major thing there. What does that mean, Dr. Shepard? That means that if someone comes and taps you on the shoulder, say hello, you blow up. That's what that is, you know.
Yeah. Yeah.
All I do is just say hello, and wow. And the last letter S is suicidality. Anytime that a person is considering taking their own life or taking someone else's own life, depression needs to be in that differential diagnosis. So depression is a real illness. It is the number one illness in the world that causes the most debilitating factors. Be aware of that. It may not be the number one disorder. At one point it was. I'm not sure if it still is, but it definitely is the number one disorder in the world that causes the most debilitating factors to go along with it.
Mhm. If a person is experiencing, I don't want to use the word suffering, maybe that would be an appropriate word, from depression, do you think they know it? Do they know that, something is going on? Or would they?
That's a good question. Sometimes they don't know. Um,
Mm,
they don't know. And I was just sharing with some of my patients this past week that psychiatry is the only specialty in medicine where the people around them can notice a difference before the actual patient does. It's
mm,
very unique. And I tell people that all the time that patients will be taking medication, they'll be in treatment, and they'll be going about their business. And the people around them will see the change. And until you point it out to them, they may not even realize that such and such is not even bothering me anymore. It's so amazing. So that phrase, see something, say something, that really applies to psychiatry because you'll be amazed. Many people may not even realize that they have noticed a change. Let me tell you why very quickly.
mm,
Depression would change your perception. It will literally change how you view people and view yourself. And if your perception is off, you may not even realize that you're off. So that's why you got to have people close to you who you can trust who can say, hey, Shepard, something a little off with you.
mm,
Don't get mad at them. What you mean? They go off and wait a minute, listen to what they're saying. They might be trying to help you to prevent you from going into a depressive episode.
yeah. I'm thinking about depression and society's, response or the response of people in your life to it. It would seem that some people would tend to frown on a person who's having a bad time like that, avoid a person. How do people, generally speaking, how are we doing as a society when we observe someone going through a rough time? How are we doing?
How you think there was a possibility? How many people hang out with depressed people? Oh my God. No.
Yeah,
we
yeah,
we do what you just said. Go over and snap out of it. Go get out of it.
yeah, yeah,
What's wrong with
yeah.
you?
Mm, mm,
We just tell them like, what's wrong with you? Like,
yeah.
why you let this thing get you down? And so we as a society have got to do a better job
Mm,
of being sensitive to
mm,
those persons who struggle with mental illness. We all deal with mental health challenges. I'll be honest with you, and I want to be clear about that.
mm,
We all, including me, struggle with mental health challenges. Again, if you say you don't, you're not you're not
mhm.
just lying to yourself. Let me just say,
Yeah.
just be nice about it. You're not telling
Yeah.
the truth. But those persons who really have mental illness and they are struggling to make it day by day, and we know that they need medication, we know that they need ongoing treatment because of the chronic mental illness that they struggle
Mm-hmm.
with. Those
Mm-hmm.
are the people who need our help. They need our sensitivity. And let me tell you something that's very scary. We're
Mm-hmm.
seeing the population grow with those who have complexity of mental health challenges.
Mm-hmm.
I was just sharing that with my boss,
Mm-hmm.
who's director of behavioral health in DC, and she said that, and I agree with her totally. We
Wow.
are seeing the number of people with complex mental health disorders increase. Why is that?
Mm-hmm.
Because of what's happening in our society and what we've been exposed to, whether it be through environmental factors or even the drugs that we take in to self-medicate.
Mm. Yeah. Well, we'll come back to that self-medication because I'm sure that's happening a lot. But I want to touch upon something that you said earlier. You mentioned, I think it might have been the word shame as one of the symptoms of someone who perhaps is struggling with, depression or maybe even anxiety. So tell us about that. I mean, what do you mean? What's shame? How does shame show up?
Yeah. So when a person is depressed,
Mm,
they may experience what's called excessive guilt. Uh,
mm,
they're guilty that they may have experienced something where um, they are ashamed of what they may have done
mm-hmm,
or ashamed that they allow somebody to do to them, which the part B is what I see a lot of.
mm-hmm,
Um, let's think about those persons who may have been abused
mm-hmm,
or even molested or taken advantage of. And what I've seen so many times is where mood disorders come in because they believe it was their fault.
mm-hmm.
Divorce, children
Yeah,
believe they're the cause of it. They have
yeah,
guilt about it.
yeah.
Mom and daddy are fighting because of me.
Mm-hmm,
Uh, Parents, adults, guilt about financial situations. If
mm-hmm,
I had not made this move, if I had done something different, I have a lot of guilt about things that I allowed to happen or moves or actions that I made. And
mm-hmm.
so people will have these ongoing episodes, literally replaying the story in their lives.
Yeah.
So they're literally
Mm-hmm,
replaying the story over and over again. And it's causing the mood disorder. It's causing the depression, if you would. So that's how that works.
mm-hmm,
We talk about excessive shame or guilt
yeah. Mm-hmm.
that's happening in that person.
Yeah, I want to stay with this because this is what you said is just so important here. Guilt, and I'm glad I like the way you put that. The person is concerned about what he or she might have done, shame, what was done to them, and then you mentioned mistakes and divorce. All of these things kind of all of these could be running together in
Yes,
one mind, right?
absolutely.
Yeah.
I mean, that's why I tell people, you just don't know what a person is thinking. Uh,
Mm,
you have no clue what a person's thinking, and I get it, because the brain holds and houses all of our thoughts.
mm,
We have 70,000 thoughts one day.
mm.
70,000 thoughts in one day, and guess how many of them are negative? 70% of them are negative.
Whoa.
So
Yeah.
what? So those mathematicians out there, go ahead and calculate it. You got
Yeah.
70,000 thoughts in one day, and
Mm,
over 70% of them are negative. Now, come on, that tells you right there that we got a lot of stuff going on in our heads. And so, when people say, I don't need a psychiatrist, I don't need to talk to anybody,
mm,
I don't know about that one.
mm.
With
Yeah.
with
That's
all that's happening, we need an outlet.
right.
So yeah.
Yeah, that's wow. I mean, that's you got the trauma piece, which could figure into the shame piece and the guilt piece. And that for some people, maybe even divorce is traumatic, right? Is
Oh
that
yeah.
right? Yeah.
Absolutely.
Hmm.
Because the reasons for divorce could be reasons of divorce that abuse happened. It could have been
Hmm.
domestic violence or intimate partner violence, as they call it now. It could have been fidelity,
Hmm.
or infidelity. I'm sorry, where people were was caught cheating with somebody else. Let me tell you, it's even more traumatic when you know the person who they've been cheating with.
Yeah.
You
Yeah.
know, it could have been,
Yeah.
God forbid, mother walks in, her husband with a family member.
Yeah. Mm. Yeah.
Can you imagine that?
Yeah. Yeah.
You know,
Yeah. That just says to me that we, well, I wouldn't say we need to be, but it would be helpful if society, if we pay attention to what people are going through, because we just don't know, to use that word again, their story, or what happened to them. So, what about serious? All of these things we've talked about are serious, but what about bipolar disorders? I mean, how do you know that you're bipolar or someone is bipolar, and what can be done about that?
yeah, bipolar disorder is a major mental disorder.
Mm,
Is classified under mood disorders, and we do see bipolar disorder. We normally see it occur after the age of 18. We
mm,
normally don't see a lot of it in children 12 and under. So when people come and tell me my child has bipolar disorder, I'm really looking for something else because
mm,
we really don't see that much of it.
mhm,
Um, so when a person has bipolar, um, they really are experiencing two different types of highs and two different peaks, if you would. There's a high peak and a low peak. The high
yeah,
peak is the mania that we sometimes see, and that people say when they have mood swings, they up and down, and we'll use
mm,
that word. Well, you just bipolar, and we need to be careful when we use those
yeah,
words because we shouldn't just
mm,
say that about people. Um, when a person is manic, they must be manic for a certain period of time, once again. Typically, for bipolar 1, because there are different types of bipolar, that mania has lasted for at least 7 straight days. And during
mm,
that mania, that person is doing a lot of self-seeking behaviors, self-gratification behaviors, spending a lot of money, pleasure-seeking behaviors, if you would. They
mm,
may be even more sexually explicit. They may be doing a lot of things that they normally would not do. And then they crash and have
mm,
low moments where they literally become majorly depressed.
mm,
Bipolar disorder is very serious because we see a increased risk of suicidality in those
mm,
patients because
mm,
of those risk-taking behaviors. They have those extreme highs and extreme lows to the
yeah,
point to where they don't want to live anymore, or they
mhm,
realize some of the mistakes that they made in the middle of a manic episode.
yeah,
I have a personal mentee of mine who was starting medical school, who went through a bipolar episode at the beginning of his medical school career.
wow,
Broke my heart.
mm,
And literally, he had to go on leave. And I believe
mm,
he's still on leave right now. Um, but he was doing some things and suffering some consequences even to this day because he did not know that he had bipolar disorder.
yeah. Well, I know that as a psychiatrist, that pharmacology is one treatment path that you'll follow. Are there any other approach to therapy that you like?
Yeah. So again, medicine does work. I want people to know medicine in the hands of the right psychiatrist is effective, period.
Mm,
Number two, you'll never hear me say that medicine is the only way in which you can cure mental health disorders, because that's not a
mm,
true statement. It's only true for ADHD. All right.
mm,
You cannot therapy or therapize or whatever the word might be, verb might
yeah,
be. ADHD requires medication. The other mental health disorders require at least a two-pronged approach. And so
mm,
you look at the various approaches. One of the things that I like to incorporate when I'm working with children in particular is the family. So we look for family therapy. We looked at
mm,
how to make sure that the family is working together. We look at parent interventions. We look at parenting classes and how to be able to handle their own mental health disorders.
yeah,
We also look at what we call cognitive behavioral therapy. And in doing so, we are able to recognize when a person's overthinking, and we began to utilize methods to be able to counteract when a person's overthinking or that black and white thinking. So there's a lot of modalities that are out there that people have specialized in, even forms of meditation that you may see. And again, meditation might not be necessarily therapy, but it definitely is a way for that people can use who are anxious to help to calm themselves down when they're in the middle of an anxiety attack or episode.
That's great. I like what you really said. And I know we're almost running out of time, but if you have time, I just have one more thing to ask you about. I mean, gosh, I got to bring you back because there are a ton of more things really I want to talk to you about. And we'll see about that later on. But in your bio, you mentioned that you offer culturally responsive care. And I'm curious about what you mean by that.
Well, I thank you for answering this question because I love this type of question. We need to understand in the United States of America that the black man and the black woman has been abused at a level that has not been appreciated yet. I'm thankful for the people who have brought it to the attention, but every day that I wake up as a black man, and even though I'm a physician, that's my profession, but I'm still a black man living in this country where racism is real and health disparities exist and where people judge me based on the color of my skin. I need to be able to recognize that when a person comes in who looks like me, I better be able to address what that issue is and be able to understand that there are some nuances that go along with that person that may not be able to or be associated with other persons from other ethnicities. Now, what is that saying? Well, Dr. Shepherd, are you racist? Are you biased? Absolutely not. I'm not racist or biased, but I speak with that strong confidence that I speak with because when I meet with other people of the other ethnicities, I must be able to understand what they're going through too. And I must be able to listen with a sensitive ear so that when you come into my office, I don't care where you came from, but I better be able to recognize that where you came from and what you're going through right now is somehow contributing to the reason why you came into my office. And if I don't do that, and I think that I see everybody as one color, I'm not going to use the word that came to my mind, but you're definitely not a smart person because we all have a story to tell. And when I embrace my story as a black man, it's not the same as a Caucasian man. It is. Now, there are certain experiences that we could have had, but they may not wake up every morning like I do and have to worry about whether or not am I going to make it home safely because a police officer stopped me and I went to reach in my pocket with no gun and I was shot dead. We don't hear those stories happening with Caucasians or with Indians or with Asians, but we do hear that story with black men. So I have to go there, and I probably go there because I let people know as a physician, I must be able to address that and address it with confidence and not scared of nobody when it comes to addressing that.
Okay. Well, I see why you have it then prominently as you identify yourself on social media. Well, look, as I said, there are many more things I would like to talk to you about. We'll have to see if you're able to come back at another time because there are just so many more things to talk about. I really enjoyed having you here today, Dr. Shepherd.
Thank you. I've enjoyed the conversation. The time has gone by so fast and wonderful questions. And again, I wish you well with this network that you have created. Wonderful network. And please reach out to me for those who are interested in learning about my services. You can go to my website at drjonathanshepard.com and you can see the different exciting things that are ongoing. If you're in need of direct care services, if you live in the state of Maryland or District of Columbia, I can help you there. I don't practice outside of those two states now. But if you're in need of direct care services, hit me up and me and my team will gladly service you.
Fantastic. Well, there you have it, folks. You've been listening to the Possibility Action Network podcast. Our guest today has been Dr. Jonathan Shepherd. I'm your host, Stephen Middleton. Until next time, good day